The general election means several things for the NHS. I think the first thing is that the NHS will be looking to the parties to see how much investment the parties are going to be promising if they were to be in government. And clearly, after 10 years of austerity, this is the number one question. I think the second question will be how the parties will tackle with the workforce shortage problem. So in the NHS, there's about 1 in 10 vacancies at the moment. There are worries about Brexit and the shortage of EU staff, perhaps not coming in so many numbers or leaving, which will exacerbate the situation. So I think that's another issue that is pertinent. But also another really critical issue for the National Health Service is, will any government have the bravery to solve social care once and for all? Many governments have kicked the can on the road on this, but unless we can sort out how to support elderly people at home more effectively than we are, there's going to be huge pressure on the NHS in the future, as we're seeing at the moment. So I think those three things are the biggest things that actually the NHS should be asking of each political party. And that's quite apart from the issue of the day, which is Brexit, which will probably affect all of those things. The first thing to look at for the parties is about investment in the National Health Service. And there they have all been quite clear about how much they're prepared to invest over the next 5 years. We know that the Conservatives' plans add up to about 3.1% of real terms growth per year, which is less than the NHS is used to, and it's less than we calculate the NHS needs to modernise. The Liberal Democrats are nearer 3.8, so a little bit more real terms growth. The Labour is over 4%. So I think each party has promised differing amounts of real terms growth. That's the first thing. The second thing, they all recognise there's a workforce shortage, particularly in nurses. And they all have said that they recognise this problem and they will employ more nurses. However, each party has been less than clear about how they will manage to do this. And I think that's something that really needs to be made clear.